As more states begin to ease COVID-19 restrictions, there are concerns over a rise in cases. The CDC recently warned of a possible fourth wave of cases because of variants and increased travel. So Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider, is joining us for today's To Your Wellbeing segment, telling us how concerned maybe we should or shouldn't be, what we can do to prevent yet another wave. She's also going to be taking your questions later on. So we'll be taking your questions later on, and you'll be able to text those questions to the number on your screen. But right now, let's get to Your Wellbeing. All right, so with areas loosening restrictions, spring break travels, all the COVID variants that are happening, the CDC recently warned about a possible fourth wave. So how concerned should we be here in North Carolina about a surge in cases?
So I want to say, since we don't have that many people vaccinated in our community, where we only have, I believe, about 40% of people older than 18 that are partially vaccinated, we still need to increase that target to get herd immunity. So I would say that the increasing travel and people doing more things in the community without a mask is a risk for having a fourth wave in our community.
All right, and so then what steps do we need to be taking to really prevent this from happening now or in the future, especially here with more summer travels and all that?
So it's more of the same messaging that, we really do know that the 3 W's work, and, we need to keep up with masking. And especially when you're going into crowds or areas where you don't know what everybody's vaccine status, the vaccine helps us feel a bit safer meeting with our families or members who are fully vaccinated, or being with a smaller group of friends that are fully vaccinated. But if you're participating in sports or going out to like larger groups or outings where you see people not wearing masks as often, then that's a concern where you may be exposed to SARS-CoV-2.
And so we're wondering, we're seeing some places where some of the numbers are going up here or there. Is that necessarily a wave? Are we worried about another wave of COVID-19 occurring?
Well, we have, our levels currently in the state represent where we had been in probably early October. And we know we can probably drop those cases further, but people do definitely have to be more vigilant about masking or, deciding where you end up going, be it for going out to eat or if you're going to be in big groups celebrating with folks. The key thing is we know that certain states that have been previously heavily impacted by SARS-CoV-2 are now seeing more waves of COVID. And that concern is that it represents the variant strains.
Okay, so some people may be a little confused. They think if people are getting vaccinated, that we can just kind of go back to complete normalcy.
I know, I wish that was the case, but I don't think the normalcy that we had over a year ago is going to be in our near future. The vaccine, getting fully vaccinated has great benefits. We feel comfortable being with others who are fully vaccinated. We feel comfortable visiting our families, and folks that may have health problems that are fully vaccinated. However, when you are going out into a crowd or going back possibly to work or going to other scenarios where there's lots of folks, you have to think right now, right? There's only 40% of the population that's had at least 1 dose. So there's at least 6 other people out of your 10 that may not have gotten vaccinated. So it's still a risk if you don't continue to wear your mask in public.
And let's talk about what fully vaccinated means, because I think a lot of people think, well, I've had my first shot or I've had my second shot, and as soon as I'm done with my second shot, I'm good to go.
I know. We see a lot of people getting their first shot and then celebrating with a photo of folks, and so your immunity builds up over time. So with the 2-dose series vaccines, be it Moderna or the Pfizer BioNTech vaccine, that takes, to get fully immunized, you need 2 shots plus 2 weeks. If you get the Johnson & Johnson vaccine, which is a 1-shot deal, 2 weeks after you receive it, then you're considered fully immunized.
Okay, so what about traveling? Because with the warmer weather, people are wanting to make plans for the beach, getting together with others. They're looking at the light at the end of the tunnel and thinking it's ready to do that.
Yeah, I think there are things that are safer. You know, still, we're asking folks, if you choose to go on the plane, you know, you're still having to wear a mask, and but the fact is that now you do have more protection on board because of your immunity. So you may not have been as risk if you weren't vaccinated. When going to the beach, the outdoor activities are much less riskier than being indoors. I think the risk is like I'm in a crowded restaurant that's like poorly ventilated. That may place you at risk for getting exposed to the variant strains.
And speaking of that, a common question that we get is, do the vaccines protect against the new variants?
So they do a good job at preventing severe illness. So we know that the trials have shown that patients who've received the vaccine are not becoming severely ill. However, you still are at risk of getting like a mild disease. So you can probably still get a flu-like illness, but not so much so that it would cause you to seek medical care.
And is there anything different that we need to do to prevent the spread of the variants, especially like the B117 that we're hearing about?
So the concern from epidemiologists and the medical community is that these variant strains are becoming more predominant. And we know that in unvaccinated folks, it can be more contagious and cause more severe illness, and also in a younger crowd. So folks who are in their 40s or 50s who may not be as sick with the previous strain may become more ill. Kind of the basics that we know is that masking works, you know, staying distance, and then also obviously hand hygiene. So it really is that balance of being comfortable that you're vaccinated to being among your close friends and your family that are vaccinated, but not taking too many risks and going out and doing a lot of things without a mask.
Okay, understood. All right, remember, if you have questions, you can text them to us for the next segment, 336-379-5775. We'll be right back.